Hello and namaste to all of you. This is Jivin Shalu Singh from Department of Physiotherapy and Diagnosis from Vidyapeeth Women's University. So for today's section, I'll be discussing with you about vitamin B6. And B6 is the term which is applied to a family of three related pyridine derivatives, which is pyridoxine, present in alcohol, pyridoxal, which is in aldehyde, and pyridoxamine. So, active form of pyridoxine is pyridoxal phosphate, or P, which is PLP. So, it is synthesized by pyridoxal kinase utilizing ATP. Now, functions of pyridoxal phosphate are, so it acts as a coenzyme for many reactions in amino acid metabolism. So transamination, these reactions, they are catalyzed by aminotransferase or transaminase, which employ PLP as coenzyme. For example, alanine plus alpha ketoglutarate will form pyruvate plus glutamic acid. Now the clinical significance is also there. So decarboxylation is there. So all decarboxylation reactions of amino acids, they require PLP as coenzyme, and glutamate, as it forms GABA, and GABA is inhibitory neurotransmitter basically, and hence B6 deficiency in especially in children will lead to convulsions. Histidine will form histamine, which is a mediator of allergy and anaphylaxis, and 5-hydroxytryptophan will form serotonin, cysteine will form taurine, serine will form ethanol amine. So sulfur containing amino acids. So the PLP plays an important role in methionine and cysteine metabolism. So homocysteine plus serine will form cystathionine, and the enzyme required is cystathionine synthesis. And cystathionine will form homoserine plus cysteine, and enzyme required is cystathionase. So both these reactions require PLP. Hence, in vitamin B6 deficiency, homocysteine in blood is increased, and homocysteine levels is correlated with myocardial infarction. Therefore, pyridoxine is used in clinical practice to prevent coronary artery disease in hyperhomocysteinemia. Next is required for your heme synthesis. So the ALA synthase is a PLP dependent enzyme, and it is the rate limiting step in heme biosynthesis. So B6 deficiency, in B6 deficiency, anemia may be seen. So next is production of niacin. So the PLP is required for the synthesis of niacin from tryptophan. So one vitamin is necessary for the synthesis of another vitamin. So 3-hydroxykynurenine will form 3-hydroxyanthranilic acid. So kynurenase is a PLP dependent enzyme. Hence, in vitamin B6 deficiency, niacin production is less, and moreover, kynurenine cannot be converted. So further, which is metabolized to a xanthionuric acid and excreted through urine. Now, glycogenolysis. So phosphorylase enzyme, or in which glycogen is converted to glucose 1-phosphate, requires PLP, and in fact more than 70% of total PLP content of body is in muscles, where it is a part of phosphorylase enzymes. Now deficiency manifestation of pyridoxine, so it may lead to neurological manifestations. In B6 deficiency, PLP dependent enzymes functions poorly. So serotonin, epinephrine, noradrenaline, and gamma aminobutyric acid, which is GABA, are not produced properly. So neurological symptoms are therefore quite common in B6 deficiency. In children, B6 deficiency will lead to convulsions due to decreased formation of GABA, and PLP is involved in the synthesis of sphingolipids. So B6 deficiency leads to demyelination of nerves and consequent peripheral neuritis, and it is reversible with high doses of B6. Now, dermatological manifestations. So deficiency of B6 will also affect tryptophan metabolism, and since niacin is produced from tryptophan, B6 deficiency will in turn lead to niacin deficiency, which is manifested as pellagra. Now, hematological manifestations. So in adults, Hypochromic microcytic anemia may occur due to inhibition of heme biosynthesis. Impaired antibody formation is also reported. So the metabolic disorder which responds to vitamin B6 therapy are xanthaniuric aciduria and homocystinuria. So the assay of vitamin B6 status is by the activation of erythrocyte transaminases by addition of pyridoxal phosphate in reaction mixture. So what are the effects of various drugs on vitamin B6? So INH, which is isonicotinic acid hydrazide or isoniazide, is an important anti-tuberculosis drug. It inhibits pyridoxal kinase and reduces the formation of PLP and causes B6 deficiency. Cycloserine, it acts as B6 antagonist. Oral contraceptives, where mild vitamin B6 deficiency may be seen in women taking oral contraceptive pills. Ethanol, where B6 deficiency, neuritis is common in alcoholics. So now dietary sources of vitamin B6. So rich sources are yeast, rice polishing, wheat germs, cereals, legumes, pulses, oil seeds, egg, milk, meat, fish, green leafy vegetables. So requirement of B6. So B6 requirements are related to protein intake and not to calorie intake. So it is recommended that adults need 1 to 2 mg per day, and during pregnancy and lactation, the requirement is increased to 2.5 mg per day. Now, toxicity of vitamins B6. So doses of 100 mg may lead to sensory neuropathy, and further excess is manifested by imbalance, numbness, muscle weakness, and nerve damage. So this was all about vitamin B6. So further about pantothenic acid we'll discuss in next lecture. Until then, take care and goodbye.